Following segment is sponsored by Munson Healthcare.
Dr. Santangelo, thank you so much for joining me.
Thanks for having me.
You bet. We are talking today about what's been happening in our hospitals for the past couple of months. A lot of people think that we've been filled to capacity with our COVID-19 patients. And while we have had a fair share of them, in fact, we've been providing medical care to other patients throughout this whole pandemic.
Yeah, that's definitely true. And throughout this entire pandemic, we've never been full with COVID patients. We have special units that we're caring for COVID patients on. And the majority of the patients that we've been caring for have had emergent conditions like heart attacks or strokes. We've also been delivering babies and welcoming new moms and new babies to the hospital through this time.
Yeah. And now that we're opening up even more, what we're hearing is a lot of people are concerned about their safety as they come to the hospital. And I want to make sure that our patients understand that there are steps that we have been taking to ensure their safety as well as the safety of our healthcare providers.
Yeah, and it's completely understandable that people are nervous because all we've been hearing about for the last several months is COVID-19 and how there are specific things that we need to be doing to keep ourselves safe. The good news is we've gotten really good at doing those things here at the hospital. And so every day, every employee is screened to be sure they don't have any symptoms of illness.
Yep.
They're trained in the use of proper personal protective equipment so that we're making sure that we're keeping them and you safe. And you're going to see us doing lots of disinfecting. You'll see us wearing masks like we are today. Mm-hmm. So we're really taking a lot of steps to be sure that we're keeping you safe if you come to the hospital.
And there are other things that we're putting into place as well for our healthcare that takes place outside of the hospital walls in our clinics. So the same kind of screening goes on for those appointments. And then we also have the option of virtual care.
Yeah, virtual care was happening before COVID-19, but we're doing a lot more of it now, and it's really advanced how quickly we've moved along with virtual care. So now virtual visits are available for specialists, primary care doctors, and it's a great way if people don't feel comfortable yet coming to the hospital or going to their doctor's office because we really don't want you to miss out on getting good health care.
And there are still some things that we would request that you come in for. So certainly emergencies continue to happen, and we would like our patients to really understand that they need to come into the hospital if they're having something like a heart attack or a stroke or some other emergent type of thing that requires hospitalization. Same thing in our primary care clinics. Things as simple as childhood immunizations or other care that's still required and needs to be done in person still needs to happen. And so there's a balance between doing things virtually and doing things in person.
Well, we've always kept patient safety and employee safety as a priority. It's been the most important thing that we've done all along. And as we've gone through this COVID-19 crisis, we've been able to enhance some of those specific items that we do to keep people safe. And we've gotten really good at managing personal protective equipment, cleaning surfaces, keeping social distancing within the hospital.
And we just want to make sure that people understand that they can take charge of their health again. There are still precautions that we're going to take. We're still in the middle of this pandemic. We're following numbers very closely. We don't know exactly what's going to happen. So it's still out there. But we do know that the social distancing that was put in place really worked to flatten the curve in northern Michigan. And we are at a point now where we can open back up to some of those procedures and other visits that are required, and really the best thing for people to do to maintain their health. You can learn more about our virtual visits option at www.munsonhealthcare.org/virtual visits.